Let's talk about low stress handling. Could you explain what exactly is that all about?
The term low stress handling was really coined, formed by Dr. Yin. How specifically we use techniques and the manner in holding animals, positioning animals for care. So that decreases their fear, their anxiety, or even discomfort with receiving care. So what I mean is, traditionally, at many of the technical schools, it's just kind of logic-based on how you're going to say, pick up a dog, or, let's have two people hold this dog while toenails are trimmed. And the main thought is just restrain or hold this animal tight enough so that they can't turn and try to bite the person, say, trimming the nail. But in the manner that you're holding them and holding them tight, like, okay, let's hold on to them, then is actually telling the animal, hey, something scary is coming on, and the dog then gets more upset because of the manner of holding, and then associates then that particular way of holding with the nails, and it escalates the fear, and then we get more sometimes agitation or even aggression, say, for doing the nails. Minor small changes, like instead of like going around the neck like this, we're going to turn the hand to like be right against the jawbone, so we don't have to hold tightly, but I've got real limit on this, and maybe we're going to give him a food reward while we're doing this. So now he thinks, oh, yummy, peanut butter, while someone's handling the feet. Then we've reduced the stress, hence the term low stress. We can't say no stress, but low stress.
Yeah.
And it is focused on handling. Now, it started with, I've got the picture here, Dr. Yin's book. She published, I believe it was in 2009, and this is really the textbook for any technician, veterinary technician, assistant, but even dog trainers and anybody else handling animals can use this. But in her book, she covers very well how to recognize that building anxiety before they get really upset, so you can stop and think of, like, what can I change here? What can I take away that's upsetting them more? How can we help them to get accustomed to this? And then remember, it's a better experience each time.
So what you're talking about, and this is part of the reason why I originally reached out to you. I also spoke with another animal behaviorist, Lorena Patty with Wagger's Dog Works, and it's part of this this positive type movement, because I think still for a lot of people the mainstream attitude about pet rearing is what they see from Cesar Millan and this alpha and like being dominating and having to do that. And I like that it's not end all be all. There's actually like a better solution, because what I learned in that podcast was, if you want to be the alpha, you want to be dominating, it's very much a short-term solution that's going to cause bigger problems down the line.
Right. When you think about coming to the veterinarian, some of the things that make it can make it difficult for the animal if we don't take some of these steps. And these changes are not huge changes, but they're significant ones. But let's just say, for example, we put that puppy or kitten on a cold stainless steel table. That's not real comfortable, and then this is in their period of kind of first learning, and then they receive, say, a vaccination that may sting a little bit, and nothing really good is happening for them, and there's other dogs barking in the waiting room that might be kind of scary for them, and then they come in a second time and they're a little bit scared. Well, by the third time, we've made a memory for them, you see, that is really negative, even though we might be like, well, what's so bad about being, we see it from our point of view, is what's so bad about being on a stainless steel table? I need stainless steel to keep it clean. Well, there's ways to keep it clean, like if you put a towel down, or if you put, a pad that can be sanitized down, and that difference can reduce, the skating on the cold stainless steel and that feeling. Now, again, the pets typically may only come to the veterinarian once a year, or maybe even only once every 3 years. Depending if they have no health problems and vaccination schedule. So if they haven't come in at other times with something good happening for them, the last memory is the lasting memory. If the last time they were in, say it was because they cut their toenail and it's bleeding and it was painful and 3 people held them real tight so you could snip it off real quick, right? And you got it bandaged up. Okay, we took care of the problem. But what would that dog remember? That it was painful to come in the veterinarian, handling the feet was painful, even just walking in the room and stuff can get them upset. So in low stress handling, you would say, okay, you've got a broken toenail, we're going to put some topical anesthetic cream on that, or we're just going to go ahead and give him sedation. Because if I cut this nail now and it really hurts him, that's going to hurt for other things. And he isn't going to come in here every week like to get a treat. I can ask you to do that, but not every client has the time to do it, you know.
Right.
Just taking this time, you know, from the veterinary staff to stop and think about the pet's perspective. What's it going to be like for them? Thinking more in terms of that way instead of like, I just got to get my job done, you know, this won't hurt that much. You know, it makes a big difference. And that's what the low stress handling movement, positive veterinary experience is about.